So this is cough and cold. So for our symptoms, we're all probably familiar with them: nasal congestion with discharge, sneezing, low-grade fever. And these are symptoms for a common cold as opposed to like an influenza or COVID-19. Non-pharmacological prevention, hand washing, vaccines. Even if the vaccine doesn't prevent us from a cold, it can help us stay healthy, and that way our immune system's not compromised. Some non-pharmacological interventions, hydration always, drinking water, drinking warm liquids can also help the throat. Steam or cool mist humidity for those mucous membranes. Might use a suction bulb on a baby or a kid that can't blow their nose yet. So just an overview of classes: decongestants, antihistamines, expectorants, antitussives, antipyretics, and analgesics, all used to treat common cold over the counter. For our decongestants, our active ingredients, you can see the left-hand side is systemic, the right-hand side is the nasal or topical decongestants. The asterisks mean it is available in an eye drop as well. So for pseudoephedrine, this is actually an interactive chart. You can click the link on the bottom if you'd like to play with it. It is regulated not only by state, but also federally. So depending on where you're practicing, there might be different rules. In Mississippi, for instance, you still need a prescription to get pseudoephedrine. You can't get over the counter. Everywhere else, it's behind the pharmacy counter, and you need an ID to get it. So these are some of the decongestants available. There are over 50 medications listed on that slide. They're obviously a lot. And sometimes they are the same brand, but different strength or form. And our decongestants, they are alpha adrenergic agonists, so it's going to lead to some vasoconstriction, release of norepinephrine. If our, vasoconstriction or norepi goes too far, then our adverse effects kind of creep up. So blood pressure might worsen, urinary retention might worsen, our sympathetic nervous system becomes activated, leading to some anticholinergic-like effects like dry mouth. Nasal decongestants have these effects a little bit less, but they do have rebound congestion. You can see there are a lot of drug-drug interactions. Those with an asterisk, it's a contraindication. For the MAOIs, no surprise, it's an important one, can lead to too much norepinephrine being released by both, and then possibly causing a hypertensive crisis. Stimulants already have a cardiovascular impact, so combining it with something that causes vasoconstriction is just going to potentiate that. You can see some of the different forms it's available in: tablets, capsules, liquids, and then you can also see some of the doses for adults. So special populations with decongestants. It is contraindicated in uncontrolled hypertension, coronary artery disease, glaucoma. Again, it's that vasoconstriction that'll get you in trouble. Caution with people with hyperthyroidism can increase heart rate. BPH and urinary retention, of course, can just worsen that. Patients with diabetes, it can actually lead to hyperglycemia. And then patients with kidney functions, we also want to be careful in that group as well. As far as peds, we don't use it in kids under 6, and we don't use extended courses for those over 6. For pregnant people, we avoid it, and it's a moderate interaction for all routes, essentially, for anything else. And we shouldn't be using them while breastfeeding. Antihistamines are next. We have 3 generations, first, second, third. So these are antihistamines that antagonize the H1 receptor. H2 are more commonly used for GI issues, so they're not reviewed here. The first gen is the oldest. They cross the blood-brain barrier, which is important considering because of that they have more like sedating side effects, whereas the second and third gen do not. So these are some of the antihistamines available OTC. Again, the ones with the asterisks are some eye drops, so you can see those. And then as far as the mechanism of action, they all antagonize H1 receptors. But again, second and third gen don't cross that blood-brain barrier, which makes sense when we think of the side effects. So first gen, drowsiness, dizziness, urinary retention. Second gen, we still have a little bit of drowsiness, but we also have nausea, vomiting, insomnia. And then some QT prolongation possibly. Third gen, fatigue, dizziness, nausea, insomnia. But the third gen, there isn't any QT action going on, which might make them a little bit safer for people. And there is a paradoxical effect for second and third gen and first to have, instead of being sedating, they are stimulating. Again, you can see a lot of side effects. For first gen, it's the MAOIs and macrolides. Second, antifungal medications due to the way that they are metabolized. And then third, we don't want to take it with any aluminum or magnesium antacids. These are just some dosage forms. They're available as tablets, capsules, liquids, eye drops, sprays, etc. And then special populations, caution in older adults just due to the CNS depression for the first gen, and then caution with those of urinary retention, history of BPH. Also QT prolongation. In the second gen, we want to caution with hepatic or renal impairment due to the impaired metabolism or clearance. And then fexofenadine, third gen, has a safer profile, but we do want to be careful in terms of renal function. For pregnant or breastfeeding, first gen is a category B for pregnant women for two of the drugs, but the rest are contraindicated. And then second gen, it is a few of them are also considered category B and okay for pregnant women. Breastfeeding is a no-go for both of them, and first gen shouldn't be used in infants or young children. Expectorants, so our active ingredient is bifenacin. You can see the tab is available, and Mucinex is probably the most popular. The method of action, it really just it helps thin out the viscosity of that mucus, so that way it's easier to cough up. Side effects, headache, dizziness, nausea, vomiting, diarrhea. Drug-drug interactions, I struggled to find really strong drug interactions on micromedics, but across the board, everything I read said you should be careful because it's often used in a combination medication, which might contain something that does have a lot of drug-drug interactions. Can see available forms here and dosing. And then in terms of caution for these patients, we don't want to use it with patients under 4. We'd prefer non-pharmacologic treatment. And in our geriatric patients, we want to be careful if their hydration is limited. Obviously, this medication uses liquid to exert its thinning effect on the mucus. And then for pregnant or breastfeeding patients, we want to use cautiously. We don't have a lot of data for either. And if we are using it, we want to prioritize a guaifenesin only formulation, so none of those combo meds. In patients with comorbidities like GERD or GI sensitivity, make sure we're really taking it with water. And if fluid restriction is an issue, this might not be the best medication because you might not get the effect of it. For the antitussives, we have dextromethorphan, available in a few varieties. It's usually a liquid or a suspension or a syrup. So the antitussives that are available over the counter are non-opioid antitussives. However, they act very similar to opioids. So the method of action essentially quiets the cough reflex. And because they're related to opioids or similarly structured, when we think about adverse effects, it makes sense. It's the drowsiness, dizziness, constipation, same things we might see with an opioid. So caution for drug-drug interactions with MAOIs, and then other CNS depressants, because like we're going to perpetuate that effect, potentiate it, and also grapefruit juice on this one. The antitussive forms in strength, we got tablets, capsules, liquids. And then we want to caution in pregnant people, it's category C medication, not recommended. Those with hepatic impairment, it is extensively hepatically metabolized, so use with caution. And that's not recommended for children under 4 and follow pediatric dosing for children over 4. Last class, antipyretics and analgesics. Active ingredients you can see on the left, acetaminophen, ibuprofen, naproxen, aspirin. And then on the right, you see the most common brands used for those medications. We're all probably familiar with them. So for these, the method of action is inhibiting the COX pathway. It decreases the synthesis of prostaglandin E2, and that's responsible for increasing fever and pain. So when we inhibit it, we decrease both. For the adverse effects, it's a mixed bag. Liver damage and rash are associated with Tylenol. The nausea GI issues are associated with ibuprofen, and then Raynaud's syndrome is associated with aspirin. The drug interactions are also varied kind of across the class, but a lot of them have to do with metabolism or potentiating an effect of the medication. So some considerations with Tylenol. We know it's primarily metabolized in the liver, so we need sufficient liver function. If there is considerable impairment of the liver, it's going to be contraindicated. We want to see if we can come up with something else. If it's cautioned, like older adults or chronic alcohol use, we maybe want to consider lowering the daily dosage, really monitoring what that cap is, what the max is, so that way we do the least amount of harm. For the NSAIDs, we want to avoid those with CBG, chronic kidney disease, heart attack, peptic ulcer disease, GI bleeding, anticoagulant therapy. For those top ones, the CKD and MI, it is due to decreased renal perfusion and fluid retention, which can increase your blood pressure. And then we know that NSAIDs have adverse effects or like irritation in the stomach. And then we just want to caution with coronary artery disease, heart failure, hypertension. We just want to monitor those vitals, maybe EKG. In geriatric patients, we want to try and avoid chronic use and maybe think of an alternative treatment. And then aspirin, again, that top one, we mentioned Ray's syndrome already. Also, aspirin, we want to avoid anticoagulant therapy or thrombocytopenia, active peptic ulcer disease, because we are at risk for increasing that bleeding. And then just caution in older adults with decreased renal function and heart failure. And then just a note about the aspirin, the doses are different for when we're using it for prophylaxis for heart attack versus pain or fever reduction. So the antipyretics, Tylenol is safe for pregnancy, breastfeeding. NSAIDs, ibuprofen and Praxin, it's preferred you don't use for either, but if you have to use something, use ibuprofen. And aspirin is just contraindicated for both. And then these are just some dosings. You can see the tabs. These are just the NSAIDs, again, chewable tablet capsule. There's also a lot of combination medications out there that we see. Again, patients need to be careful of this. They might not realize that they're getting an ingredient they didn't think was in there. And then some of our medication safety issues you can see here. Medication cost, we took the medication. It was a 7-day course for every medication except Afrin. That was a 3-day course, and then just figured out how many doses we would be taking each day based on time, either Q4, Q6, Q8, Q12 for some of them, and then tallied how many doses that would be total. Prescription options for these, the decongestant, you can get pseudoephedrine at an increased strength for sure. Antihistamines, we've got hydroxyzine, desloratadine, promethazine. For the expectorant, guaifenesin comes with hydrocodone. Again, that like opioid might be able to quiet the cough reflex. And then there's NAC, which is actually available over the counter, but only as a dietary supplement. So it's going to be different dosing. And then for antitussives, you can get benzonatate. There are opioids available, obviously, like we mentioned. And then for the antipyretic and analgesics, you can see at the top line is all of the medications except for codeine that we mentioned. They're just there at a greater strength. And then in the second line, you can just see some more NSAIDs. And then these are the references. Thank you so much.